9 million face masks to support healthcare workers worldwide. That's the donation AstraZeneca has provided to fight COVID-19 with the assistance of the forum's COVID Action Platform. And the first shipment of their masks was sent to Italy in late March, with the company continuing to set examples for businesses globally in terms of their response to the coronavirus. I'm Katie Cliff from the World Economic Forum, joined this morning by Pascal Soriot, CEO at AstraZeneca. Thank you for your time today. And I guess we'll start with the latest on the delivery of your donation. We saw the first masks being shipped to Italy at the end of March. Other countries were to follow. What's the current status on the shipment?
Good morning, Katie. Thanks for having me. We are well on our way to delivering these 9 million masks. About half of them have been shipped already, and the rest is about to be shipped in the coming days. So very, very good progress on that front.
It's wonderful to hear, and I think the efficiency of you making the donation and having it shipped to those areas most in need so fast. I mean, you partnered with the COVID Action Platform, the Forum, the World Health Organization. Tell us about that partnership and why it was so crucial in the efficiency of getting this donation through.
Yeah, this partnership has really been great, actually, because what we needed to do was to make sure that we would deliver those masks where they are needed. And quite frankly, we didn't exactly know where they were most needed. So we partnered with the Action Forum, the WEF Action Forum, that guided us in terms of where to ship those masks. We worked with DRI in the US and South America to do the shipping, and we worked with other organizations, but really this partnership with the WEF guided us in terms of where the needs were and where to ship. And the second thing we needed to do is to do this fast. And to be able to do this fast, because getting masks when they are no longer needed would not help anybody, so they are in great need now. And again, the Action Forum guided us and helped us deliver those masks very quickly. So it's been really very successful.
I think it's very important what you mentioned in terms of the efficiency to get this donation out to the areas that need it. I mean, AstraZeneca is also looking into testing capabilities. You've invested in research and development. Tell us about those other initiatives and why they're important in the fight against coronavirus.
Yes, so we have really tackled this epidemic on a couple of fronts beyond the donations we've made. One is really looking at the virus and testing, and also the second, and I'll talk about it in a minute, is treatments that we can develop for it. As far as the testing, many countries really have realized they need substantial testing. And we have developed our own test together with a diagnostic company that is providing the diagnostic kits. In the UK, we are working with the government in partnership with GSK and the University of Cambridge and a local diagnostic company that produces the kits to actually deliver 30,000 tests a day very, very soon. And we are partnering with governments around the world to share our technology and our expertise. Building these capabilities around the world to increase testing is absolutely key. Yes, we are investing also in treatments. So we're developing an antibody. You can treat the virus with antiviral agents, so you can also develop vaccines. Our approach is to develop an antibody, a so-called monoclonal antibody that will target the virus and can be used either to treat patients who are infected or used also as a prevention. It's a long-acting antibody. We have a specific technology that enables us to do this, and we're working at full speed to have an antibody in the clinic by the fall and a product that can be used next year. Another area of focus has been the immune response, because as you may realize or may have heard, the virus itself doesn't seem to kill people. What kills people is the immune response, and some patients tend to develop this enormous immune response that creates an inflammatory reaction in the body and affects their lungs to start with, but also destroys their heart and their kidneys. And so we have a product that is already marketed for another indication that can turn off the switch, we believe, of the immune response. And it's a very high switch that is high in the cascade of production of inflammatory chemicals. And if we turn this switch off, then we'll stop the immune response. So we have already treated 7 patients in the US at the National Institute of Health, the NIH, at the Walter Reed Hospital, and also in Colorado. And we're now expanding this in a full-blown clinical study that will start this week and into next week to show that we can turn off this inflammatory cascade. And if you do this, you basically stop patients from needing an incubator, to needing a ventilator. So that will enable the hospitals to deal much, much, much better with the flow of patients that have been overwhelming them.
So, like we've said, a range of initiatives you're investing in. It doesn't look like you will let up anytime soon, which is fantastic to see. What's your, on a business front, what's your message for other companies who are maybe not sure where to place a donation, they're not sure where to begin or continue the fight against coronavirus? What would your message be?
Well, our message would be try to partner with the people who have the knowledge, partner with the WEF, the Forum for Action, because really this is a very useful partner in terms of deciding what to do and where to do it. Partner with governments, partner with WHO. We should not try ourselves to basically decide where the needs are and what to do. But I also would suggest that giving money is not sufficient. A number of companies are giving money. I think the countries today are not really needs of money. I mean, you hear it every day. Billions and billions of dollars have been allocated by governments. What governments need is help in terms of supply chain, sourcing materials, also help in terms of capabilities, skills, expertise. And this is what we're trying to do. Giving money to buy masks, for instance, is not sufficient because you have to source those masks and everybody is competing. Our strengths in China, we are the #1 pharmaceutical company in China. We have a very broad network of contacts. Those strengths enable us to source products that and equipment that governments may not sometimes be able to source themselves. So provide this help not only in money, but also in capabilities and expertise.
Is an important encouragement to businesses. Pascal Soriot is the CEO of AstraZeneca. Thank you again for your time. And we have been mentioning the World Economic Forum and the COVID Action Platform. We invite companies globally to join the efforts, join the partnership, and you can find out more details at weforum.org.